Today I'm joined by Candice Williams, clinical psychologist trainee at the University of Hertfordshire. Candice is running a study on the care received by Black people who gave birth during the pandemic. Hi Candice, how are you doing?
Hiya, thanks for having me today.
Thank you so much for joining us. So this is a subject that people have seen more of recently. They're starting to understand that these disparities in healthcare can affect people of different races disproportionately. Why have you chosen to focus on this issue for your study?
Well, I think you outlined it quite well there. There's a long-standing history there that we've known about for a long time. But I think for me, being a mum myself, I'm Black mixed heritage, and I suppose it's thinking about not just my personal experiences, but family personal experiences and the potential for that to be ongoing in our future generations. That's really what's motivating me to use this opportunity, use this research, and my position as a psychologist to think about what else needs to be different, what else can we think about, how else can we make sure that people's voices and experiences are captured in the literature.
Yeah, absolutely. I mean, it is such all the facts and everything that come out around it and all the statistics are so frightening. And I know, like, for just anecdotally, some of my friends, my Black friends, have said themselves, like, oh, well, I'm a little bit scared. I'm scared to have baby. I know I personally definitely walked around with a lot of fear around that because I'm like, look, if I'm going to hospital to have a baby, I just want to go in there and then come out with a baby. I don't want anything to happen to me. It's quite frightening. So it's so good that you are focusing on this and, you know, going to like pulling this study together. So what did the statistics show for Black women within the 2021 Embrace UK Saving Lives Improving Mothers' Care report? My goodness, what a report title. Did I get that correct?
Yeah, you did, yeah.
Yes. What does statistics show?
I suppose, first and foremost, the researchers that are looking into this year in, year out, are bringing really important information together, making some really important recommendations to try and improve maternal health. There's an element that I think that it does bring accountability because it presents things in a real clear, accessible way, not allowing for inequalities to be minimised or held sort of so contextually. And again, I suppose, going back to your first question a little bit, I think it's very easy, perhaps, where people have had some really difficult experiences, myself included, that we might think, oh, maybe it was something that I did. Maybe there's, it was unique to me at that time. But actually having reports like those Embrace reports, you're able to see actually this is bigger. It's not just about the individual. So going back to what it showed for this year is that I suppose despite overall there being a reduction and improvement in mortality rates and neonatal deaths being the lowest that they've been, unfortunately for people from Black backgrounds and Asian backgrounds, things have remained the same, and it's quite frankly it's unacceptable. So I suppose over the past 10 years there's been sort of very little to no change. At the moment, people from Black ethnic minority groups are 4 times more likely to die than women from white groups, and then women from Asian backgrounds and mixed backgrounds being twice as likely. And I mean, we know that there's other inequalities that birthing people are facing. Sometimes it's linked to socioeconomic status, but I think importantly this report does, I think it speaks to a lot. There was another rapid response report that was done earlier on in the year that focused on COVID in particular, and even then that showed how sort of the disproportionate impact that COVID was having on people they put everyone together from Black, Asian and minority ethnic groups, and it sort of showed at that point, at the very beginning of the pandemic, that sort of 88% of the women that sadly lost their lives were from those minoritised groups. So I think the fact that then the Embrace report that was published only a couple of weeks ago, I think just really shows that although that's not pandemic contextual, that it's anticipated the next report that will tie in with the pandemic is likely to show even more of that picture, and likely to open up what we've already seen and what we will continue to see in coming years, the impact of the pandemic being just profound. Again, I think there's some really important recommendations that have been raised in the Embrace report. They speak about it being imperative to address systemic issues and cultural and structural biases. But I think when you hold that in mind with the long-standing sort of backdrop of inequality, this is exactly the reason why I'm doing my empirical research study, because enough is enough.
Yeah, absolutely. And I think it's something that, obviously after June 2020, when the world or parts of the world realised that racism does in fact exist, this was these statistics were something that came out of that conversation, where essentially we were trying to highlight, yes, racism is systemic. It's it's all of these things. It's not just people shouting things at you. It's that kind of ingrained underlying, it's banal, it's all of those things, and they all contribute into something like this serious, where people's lives are absolutely at risk. And it's so important that we talk about it, and people like Candice Braithwaite, who's been talking about this for a really long time, 5 times more. And then obviously there was the documentary with Rochelle Humes. It's so important that these things are brought to the fore and that we understand them. And like you were saying before, there's some parts of medicine have moved on, but other parts have just stayed static. And we know already that there are huge inequalities and disparities within gender in medicine. So, to be at the intersection of gender and race, my goodness, it's kind of makes it even more dire and makes this so much more important. So
Yeah,
what
absolutely.
surprised you most when you were researching for this?
Before sort of starting off writing up my proposal for my research study, it's, we as researchers scope the literature, see what's out there, and there is some brilliant work that has been done by researchers. But I think given that we've known about these statistics for a very long time, it just feels like there's not enough that has been done that really captures what that lived experience is like. So essentially your qualitative research, there's a lot on quantitative, so your statistics, your numbers, what the inequalities might be sort of saying in that regard. But there's just a question for me that was raised at that early point of, well, what does this mean? This is people's lives. What's that been like? What's that felt like? So that felt like a really important area that needs addressing further. As I said, this is building on some brilliant research that's been done by people like Professor Dawn Edge, by Professor Jenny Douglas. There is a lot of shoulders of people that I'm standing on, black researchers, but I think it's important that more and more that there needs to be a sort of rigorous and relentless focus on this, and until those inequalities can be reduced. I suppose holding in mind that, again, we've known about this for such a long time, it feels that there's enough that has been maybe gathered more so anecdotally around, and again the backdrop again of the past 18 months for our communities it's been a lot. It's been intense. People are asking people to share their experiences and their stories over and over again. So holding in mind that if you've got that aspect of it, but at the same time, I think that's where it differs from sort of research, where recommendations can be made, things can be put to change policy, to change services. Sort of it's sort of, you're really tapping into that literature and the evidence base, whereas I think as we know from the conversations that have happened, perhaps there have been some quite narrow-minded views around, well, if it's not documented, then how can we be sure that it's happening, and sort of questioning and everything else that comes along with it. So I suppose holding in mind that just research is really important, I think, for us as communities to address, like you said, all of the inequalities across lots of different sectors. Yeah,
absolutely. I think you made a really good point in there as well, that particularly since the big reveal, I'm going to call it from now on, they embarrassingly enough, for people who are not at the receiving end of racism, in order for them to connect with it, because they are so disassociated from your humanity because of just the structure of white supremacy, racism, etc., they need you to re-traumatize yourself to tell them how it feels for them to understand it. So you've made a really good point that people are exhausted with that. I know that personally, I was exhausted with people. Some people were contacting me to check in without asking anything. That's great. But so many people were having that conversation because in order for them to connect with it, they needed me to tell me what's happened, even though everything is there and Google is free. So I can imagine there might be some reluctance for people to take part in things. But I think it's like you were saying, it's important that this is very different. Research is very different from anecdotally telling somebody something because it's the only way they feel they can connect with you, when really they just need to go to a therapist. So it's important to say that this is you holding a safe space for Black birthing people to talk about this in a way that could essentially have a positive impact on them and the future.
Yeah, absolutely. I think you've raised some, I think, just really important context that I think that we all have to be mindful of, and I suppose within, appreciating there's red tape around sort of research, and there is obviously affiliation within institutions and things like that, but that the processes around that are to ensure that people that agree to take part, that they're being sort of safeguarded as much as possible. So there's a lot of thought that goes into the planning, the debrief, the consent process, just to make sure that there's a process around it. So if people do decide that they want to opt out by a certain point, then that's okay. They don't have to give a reason. But again, I think it's just being mindful that that there is a lot of pathways and processes that go into putting together empirical research, and again acknowledging that there's an element of mistrust, whereby perhaps in the past research studies perhaps haven't been inclusive. Not perhaps, they haven't been inclusive. Yeah. So yeah, I think it's important. I think for me anyway, as the primary investigator, as the researcher, to own my context, and in the hope that I'm not just doing this for me, for the institution, or for my qualification. I feel like I'm doing it for my community, for my family, my future generations. This is bigger than that. But I hope that the processes around me support people to feel that there is an element of trust that can be built and worked on, so they feel safe enough to share their experiences. Because people are very generously giving their time and sharing their experiences of things that have gone okay and gone well, and things that haven't gone so well.
Mm-hmm. Absolutely. And as in a previous podcast, we spoke to the founder of Hysterical Women, and she runs a service and runs a site where she talks about gender inequalities in medicine. And also she talks about the gender inequalities in medicine for women and women of colour, Black women, Asian women, etc. And it was so interesting talking to her about all these different things that affect women, because historically research has been around men and boys and what affects them, because of the disproportionate amount of men that were allowed into medicine. Because obviously, let's not pretend that gender, race, etc. weren't huge barriers to people actually even getting into these fields and being able to focus, I suppose, increase the scope of the lens. And we know that it's incredibly important to focus on research and looking at lots of different people, much wider demographics. And that's been shown to us, like, for example, there's a statistic that I remember Sarah telling me in that pod, that women are more likely to have a heart attack in a hospital because the markers for a heart attack for women are completely different from men. So we're like genuinely 10 times more likely to die from a heart attack because doctors aren't trained to spot it in the same way. And we've seen an explosion in the diagnosis of ASD for women because the previous markers weren't the same and the parameters weren't the same. But as research has expanded, we're able to get to that point where we can start improving the lives of people. So it's so important to take part in these things and take part in these studies. But I think, again, you pointed out that there can be absolute elements of mistrust in there. I mean, what's happened historically, not even historically, I was like saying, we know what's happened historically with Black people. We know what happened yesterday. It's not even historically, is it? We know what's happening at the moment. But I think I've loved what you said about the reasons you're doing it. And obviously it feels safer because it's someone of Black mixed heritage that is thinking about their community as well and how they can help with that. And I think that's just really great. So how are Black women actually suffering when it comes to like maternity healthcare disparities?
It's a good question. I suppose from what I've read of sort of the research that's been completed so far, there's, I think, continues to be a lot of difficulty with perhaps people feeling that healthcare professionals aren't being sort of culturally sensitive, that are being ignored. And, we know that even up until sort of 2020, I think it was Martha, Morris and McNamara, hopefully I've pronounced those names right, again tapped into the biases and stereotypes and perceptions of labour pain from professionals at individual and structural levels. So again, sort of lending itself essentially to the notion that Black women experience less labour pain than white women. And that links in with, with what you were saying in terms of the medical context, just how much has been normed on particular groups, and therefore what happens in situations. And also I was watching, it was only released the other day, The Bias Trap. It was a short film that's been produced by the Southeast Perinatal team, and there is some harrowing and just tragic lived experiences that have been shared, in that it's a collaboration between professionals and women and families from people from Black and Asian backgrounds, and just highlighting again how perhaps people have just not been seen, have not been heard, and the tragic outcomes that can happen in regard. So I suppose a very long answer to your question is this, that the suffering is real, it's traumatic, it's huge, it has huge ripple effects. And I think sometimes you're not able to really understand that, I think, until perhaps someone sits and asks you a question. I think for a lot of us, day in, day out, where perhaps we have experiences that we're used to, you have to get your head down and you have to continue, and perhaps there's an element of desensitizing to things. But actually, when you're in a context where you're really reliant on professionals because your body is going through something so major, and you're trying to protect yourself, trying to protect your unborn child, that adds a whole nother layer onto what it means to advocate for yourself, to look after yourself, to do what needs to be done to get through.
Yeah, absolutely. And there's so many, oh my goodness, the amount of the things that you said throughout that. When I'm doing any anti-racism education training, we talk about implicit biases, we talk about unconscious bias, etc., because people do not realise how much that affects people, and people don't realise how biased they actually are until they do that Harvard test online. And I remember actually in a session I ran, and I talked about these statistics of Black women being like 4 to 5 times more likely to die, when going through maternity care. A nurse actually piped in and said, no, that's not true, because I'm a nurse and I know it's not true. That's what she said, a white female nurse, because she decided it wasn't true, even though statistics support it, and she thinks that women of colour, Black women, Asian women, aren't treated any differently. And she was so married to that. It was only when we were able to show her all the evidence and then also give her really specific incidents, then she was like, oh. And I was like, yeah, because, and I said, the way that she was so, I don't know, how much she staunchly believed that wasn't the case must be such a barrier. If you don't address or accept that you have any bias whatsoever, it's absolutely you're going to do things subconsciously that are going to affect people. And you made a really good point as well, that the microaggressions that we're on the receiving end of do become so normalized to us after a while that until someone asks you and puts something into context, you're like, oh yeah, that did happen to me. And that can actually in itself be quite traumatic. And so there is an element of, I just have to keep my head down and carry on so I could get through the day. Because if you were to sit down and address every single one, my goodness, you'd be in a hurt locker. It'd just be the worst, wouldn't it? And it's the narrative, I suppose so much of this as well plays into that narrative of black women being strong and black women being angry, and there's like no other space for us to exist. Because then if you're strong, it's about you're physically strong. You don't feel pain the same way. You don't feel emotional pain the same way. And if you're assertive, or even if you just blink, then it's aggressive and you're angry. So then it makes it difficult to advocate for yourself or just live your life. And if people only see those two sides of you, my goodness, of course it would bleed into healthcare. Of course it would bleed into all these other areas of life when you're just trying to exist. And it must be so incredibly scary to, like you were saying, to be in that position where it's not just your life, it's the life of your child or children if you're having multiple births, and you're in the hands of the professionals and you're just hoping that they aren't biased. You're hoping that they aren't actually racist, because there was a story that Candice Braithwaite talked about where a mummy blogger was basically kind of launching racist attacks via other mummy bloggers on some weird like secret site, which is just, I don't know, some nonsense. But she turned out to be a midwife at a hospital where she was receiving lots of Black, Asian and minority ethnic patients. And this woman is genuinely racist. So my goodness, how must that be bleeding into her treatment of those people as well? So it's quite scary. I was going to ask the question, how did we get here? But I feel like, how many years have we got? And also it's just, we got here, slavery and colonialism. That's how we get to all of these things, isn't it? So knowing all that and knowing the pressures that Black women are under, the pressures that Black people are under, and just like you were saying, having to get your head down and get through it, how can Black pregnant people advocate for themselves if they are in a position where they're not sure they're receiving the right care, or something, I don't know, terrible is happening to them?
Yeah, and it's a great question, and I think it's gonna differ depending on your context. I think, self advocacy, I think, just important at a societal level, sort of anyway, but even more so because everyone, regardless of who we are, has the right to have safe maternity care, to have the same care that other people get, the people that are getting the better outcomes. So I think trying to equip ourselves with knowledge around how the system works, the structures of the perinatal world, I think is important. But then also acknowledging in the same breath that sometimes systems aren't always set up to support people to have the access or to navigate those systems as they should be able to. So I suppose for me, sort of first and foremost, it's thinking about, well, how can I question, how can I gain clarity to understand either what's going to come next or what has just happened. Again, services and maybe local support is going to differ dependent on where you live, but familiarising yourself as much as possible can be really key. I mean, there are some amazing grassroots and charity organisations. You've already mentioned 5 times more, and their website's got some brilliant resources for women and birthing people around steps for professionals, steps for birthing partners, steps for people themselves, just to help and support with that advocacy process. And I think in some ways, as much as I think we've acknowledged the disproportionate impact of the pandemic on our communities, there's also an element of, it's brought along with it, people have needed to share information differently because we haven't been able to go and do things face to face. So actually, just looking online, looking at webinars, different trusts have made, different sessions that are readily available for, I think, just how to care for ourselves during this time. But I think, again, even though obviously I've said, try and question, try and get information, I think it's just holding in mind that whatever happens, whatever steps you take that are important for your journey, it's just holding on to that self-compassion, trusting in your own intuition, listening to your body. And I suppose, if you can connect with people around you, then then brilliant, go for it. I mean, there are other organisations, Birthrights, who support with advice, and legal information around what's available to women and birthing people. They train healthcare professionals, and yeah, they're campaigning actively to change maternity policy and system. So I suppose, yeah, just trying to familiarise yourself with what's out there. And I suppose, Instagram is also a wonderful place. There's lots of individuals and groups that are popping up, where people are really thoughtfully sharing resources and knowledge, experiences. So you're able to really get a sense of, okay, what's happening around me in my community. How can I go into this process of transitioning to a parent, and look after myself in that. So yeah, taking the steps that feel right for you and using the people around you, I think, is really important.
And how can mental health and well-being be supported during the perinatal period? I mean, you've mentioned some great organisations there, but how can people get support during those times? But also, how can we support people who are going through that too?
Yeah, again, a really good question, because I think similarly with sort of what's your sort of maternity care, physical health provision, again, sort of mental health can differ as well, dependent on where you live, what's available to you. But to be honest, I think you tapped into something really key earlier around that narrative of the strong black woman, and what it might mean to seek support and to seek help. And it's worth being mindful that this can link in with professional assumptions, with accessibility to service. And there was a study that was done only last year, actually, that looked at, with regards to sort of perinatal mental health specifically, the sort of obstacles for the engagement wasn't so much once the support and the appointments and the access was given. It was actually the structures around sort of referrals and access themselves, which I think again sort of maybe speaks to how things can be done differently at a service level. So similarly, familiarising yourself with what services are available, perhaps where you can get a self-referral or where you have to go through the GP, for example. One thing that has come out of the long-term plan within the NHS is maternal mental health services, where it's predominantly supporting people that have experienced trauma and loss during the perinatal period. And again, each locality perhaps are rolling things out slightly differently, but some services are offering the opportunity for self-referral. So again, I think it depends on what you feel that you need support with to help with well-being, what would be the most important for you at that time. And even if sort of now isn't the right time to explore any more formal support, I suppose it's just knowing that there are services that exist that should that be helpful in future. But again, similarly, with sort of advocating for yourself, seeing what's in the community, seeing what informal peer support groups are around. I know the motherhood group, for example, have really reached so many people, and a sort of advocate for mental health support. They made the first sort of annual maternal mental health week for black mothers and birthing people, which is just brilliant. So yeah, sort of keying in with what's going on at a wider level as well can be helpful. There's online Zoom groups that I'm sure that people can tap into for that sort of peer support. Yeah, I hope that answers your question.
Yeah, that really does. What needs to change, and how can we start to improve our healthcare system for black birthing people?
Wow, that is a monster question.
I know it's huge. Sorry, I thought that's why I thought I'd save it till this point.
I mean, to be honest, there's something that stood out to me. I read it was a paper that was written in America. It was like a research working group. I'm trying to think of the name. Black Mothers Matter Alliance, I want to say, or Maternal Alliance. And they spoke about the importance of sort of acknowledging sort of racism as a risk factor, and not so much thinking about the construct of race as a standalone risk factor, but acknowledging sort of what racism does within that process. So I suppose to answer that monster question, it feels like there is a ongoing, I think, lessons and reflections to be learned around how the system can, like you said, open up, have different lenses of knowing, understanding, seeing distress. And I know sort of in professional spaces in particular, you know, cultural competence is sort of used as a way to support with training so people are become more aware. But actually, for me anyway, that competence makes it feel like it's something that you can achieve. And then once you are competent, in quote marks, that you know you've done all you can, and that's, you know, your learning is done. But I think, you know, terms like cultural humility, I think, lend themselves much better to things being a process, to that learning not just being about other people, but about ourselves and our own assumptions, our own biases that we all hold. So, and I suppose alongside that, having the collaboration of people that have had experiences that have been helpful and unhelpful to inform policy and service changes, I personally believe is key. So it's integrated into policy, it's integrated into nice guidance, because without sort of hearing directly from the people that are being impacted by these inequalities, how do you truly know that what you're doing is helpful, is making a difference? And I suppose that for me was such an important part of my empirical research study, was just that question just kept coming up. How can I hear directly from people? How can I platform voices? Yeah, how can we know what needs to be different, what needs to change? Yeah.
Yeah, absolutely. And I think what you were saying there about structural humility, the part that plays, is so key. It's key to everything, isn't it? Us understanding, it's like almost like understanding yourself and the framework of everything, and understanding what affects you and what may affect other people as well. And also kind of, I suppose, what you're taking as well is a really specific, I suppose, responsibility in trying to, I don't know, reform that healthcare system as well through this study, which is just so, I don't know, like I've said, it's so important so many times, but because these statistics are so jarring, they are so shocking. So where can we find out, where can people find out more, where can people sign up, where can we go and find out more about this? How can we support this?
So I've got a Twitter page which is at Declin Perinatal. Got an Instagram page which is Declin Perinatal Research. You know, people can email me if they've got any particular questions or thoughts, having, you know, heard us talk a bit today. I can give you my email after we've finished. But I suppose the more that things can be engaged at a community level, I feel that that's where research should sit. So as I said, you know, it's not just about doing this because I'm, you know, in my final year of my doctorate, but it's more so how can this be a process of doing together, and how can we, you know, using the research opportunity of adding to the evidence base, you know, how can we make this collaborative? So yeah, I welcome any sort of questions, or if anyone wants to find out more, there's a consent form, there's an information sheet that goes out to everyone as standard, just giving a little bit, you know, more information. There's also a recruitment video that I filmed as well, that might be helpful for people to see and just get a sense of what the study's about. But essentially it's an opportunity for people to have a one-to-one interview and to share what's been helpful, because at the end of the day there's an element of if people are having experiences whereby, you know, people have been sensitive, people have heard them, people have listened, then it's really important to capture those stories so everyone's care, you know, those moments of best practice can be shared across the board. But you know, in the same breath, the interviews also ask about if there's anything that's been unhelpful. So again, really offering that space for people to be heard, people to have their stories shared, and their voices, their recommendations put forward. That's a really key part, is thinking about, you know, what could be done differently across maternity and mental health services to improve these outcomes across the board. So yeah. Sorry, you didn't actually ask that, but I've given you more information anyway. But yeah, welcoming any questions or comments that people might have. about what's involved.
Yeah, thank you so much. I mean, it was great to get that information. And I mean, I commend you on your socio-professional activism because, like you said, it's not just about doing this study for you. It is about the impact on the community, the impact on future generations. And I think that's so important. I really hope that people come through and take part in this and we're able to really learn a great deal and really, I don't know, start to reform the system. I know there's lots of different work that different organisations are doing, and it's so vital, and it's such an important time. And thank you so much for joining me and taking us through this. I really appreciate this.
No, thank you for having me. It's been great talking to you. I feel like we could have spoken for a lot longer.
I know, right? So I should have written more questions.
No, thank you so much.
If you would like to support the campaign for equitable maternity and mental health care by sharing your experiences and ideas, please get in touch with Candice. Via Twitter, it's at DCLIN_perinatal. And on Instagram, it's at DCLIN_perinatal_research. Thank you for listening to Speak On. Make sure you like, subscribe, and share with your friends, family, co-workers, strangers in the street. To find out more about us, including our upcoming events, head over to Instagram, instagram.com/speakon_. Bye!